The Ghana Medical Association is strongly alerting of a possible outbreak of diseases in the coming days if the power situation is not immediately resolved. And according to the GMA, the failure of the ECG and VRA to provide a reliable timetable to help them plan is gravely affecting their work. Vice President of the association, Professor Dr. Ernest York, hints that most of the health facilities are currently overwhelmed, and if the situation continues, children will suffer in the intensive care unit, vaccines will lose their potency, and decomposing bodies at the mortuaries could possibly lead to outbreak of diseases.
All we need, as those of us in the health space, is stable and reliable power. It doesn't matter whose Dumsor is worse or is better. We need stable power, reliable power, and a timetable to plan and ultimately to save lives. We're hoping that things will change, but if it doesn't, the way we're going, certainly there will be more queues at the outpatient department because the electronic management systems will be down. There may be fatalities or worsening of patients when we admit them. Surgeries, we know the obvious consequences if lights go off during surgery. Even at the morgue, bodies can decompose, diseases outbreaks may occur. Even the children may suffer in the intensive care, the unborn babies, the born babies. And again, linked to the children is vaccines, because you need a cold chain to preserve the potency. So if they lose that cold chain, they lose its potency, you cannot vouch for its potency to be able to prevent the disease that they want to die.
On the other hand, Lucia Dai, Executive Secretary of the Pharmaceutical Manufacturers Association of Ghana, says they will be left with no option than to lay off workers if the unstable power situation persists.
If nothing changes, it could be dire. The honest truth is that if there's a lot of pressure on the companies, we would have to let people go home. We have to cut down on production. We would have to find alternative ways of making power available. But if the cost is too much, companies would have to close. And we don't want that. We want to be able to increase the number of pharmaceutical manufacturing companies we have. And so we don't want that very gloomy situation. Everybody's trying to stay afloat. Everybody's trying to do their best. And so we don't want a very dark picture. But it could be that if we are not able to tell what needs to happen and, what's going to happen next.